Now, from the Signature Bank Studios.
This is Chicago's Morning Answer with Dan Proft on AM 560. The Answer.
Top of the morning, Dan Proft here. So the affordability conundrum, so much of it is being driven by health insurance costs, particularly with Obamacare imploding, as all of these centrally planned gambits inevitably do. And as we talked about just a little week or 10 days ago with our next guest, a lot of Americans seeing real spikes in premiums as well as in deductibles. And so the president trying to address that, theoretically talking about getting money directly to American families to make their own health care decisions, trying to sort of backdoor undo the backdoor takeover of the health insurance industry by the state, turning it into an oligopoly. One of the things Trump is trying to implement to provide some relief is Trump RX, Trump the pharmacist, the government as pharmacist, and bringing the costs that Americans pay for pharmaceutical drugs in line with the prices that are paid by countries around the world. Good idea in theory, but it's not without its own complications. For more on all of this, pleased to be joined again by the most knowledgeable man on health insurance in the United States of America. He is C.Steven Tucker, the founder of healthinsurancementors.com. CS, thanks for joining us.
We did.
So Trump RX, I know we've talked about it before, but now that we've got Dr. Oz out flacking for it and Trump making the commitment that you will pay lower prices for pharmaceuticals because we're going to be aligned with what the big pharma companies charge other countries, you know, using the old argument, we're using our leverage, our massive purchasing power, the state being the largest consumer of healthcare services and products. We're going to use that to bring down prices for you. The great promise of government price controls rears its head again. What do you think will be the likely outcome for, Johnny Punch Clock and Sally Housecoat?
Well, Trump RX, I spent some time yesterday after it released at 7 p.m. You could actually use the tool. And Trump RX is giving the same prices for GLP-1s like Ozempic, for example, that you can get without having to appeal to the pharmaceutical company. You can just simply go to goodrx.com, get the exact same discount that Trump RX provides for Ozempic. And so it's nothing revolutionary that's happening with TrumpRx.com. In fact, when President Trump was still just a game show host at The Apprentice, and when Democrats and Republicans both loved him because he donated to both parties, I was speaking down south Illinois in Chillicothe to a big group down there. And when I finished my speech, a woman came up to me afterward, and her son had just been kicked off of Medicaid because, of course, they made $1 more than the 138% of the federal poverty level, or 318% if you have children. And he lost eligibility for the very expensive medications that he uses to control his epilepsy that he's had since he was a child. And so she was fretting how she's going to pay for these crazy costs of these medications that he desperately needs. And so I told her that she can apply directly to the manufacturer, and the manufacturer will provide it for you for free. Or if anything, a very, very small copay. And she looked at me like I was speaking a foreign language. How could this be possible? Well, she did exactly as I instructed her to do. And she sent me an email later and called me and said, I can't believe it, but I'm paying nothing. And he doesn't have Medicaid. I just appealed to the manufacturer. And so this was happening long before TrumpRx.com. The good thing about TrumpRx.com is for people who don't know that, and I suspect that's a lot of Americans, they're now going to find out that you can appeal directly to the manufacturer. And if you have private health insurance, for example, you will pay nothing for expensive medications, including biologics. Yours truly takes a drug called Dupixent. I use it to control my allergies and polyps that grow in my sinuses, and it's $4,468 a month market price. I have paid nothing for that medication for 5 years because I appealed to manufacturer of Dupixent. I have private health insurance, and I pay nothing. And so TrumpRx is connecting Americans to that, and I suspect many of them don't know that's possible. So that is a good thing. But again, if you need a GLP-1, like Ozempic, you don't have to appeal to the manufacturer. You go to GoodRx.com and get the same price you will find at TrumpRx.gov.
I wonder if that's where JB Pritzker goes. So what is GoodRx? GoodRx.com.
GoodRx is a publicly traded company. And for years, they've been competing against Mark Cuban's site, which is SaveRx. And they've done it better than Mark Cuban has done. Their prices are lower, and they've done it so well that they're now publicly traded. And we've been using GoodRx.com for years. But there are drugs there that are very expensive. For example, Mounjaro, another GLP-1, is about $1,000 a month at GoodRx.com. But if you purchase it from Canada via UniversalDrugstore.com, you will pay half that price because it ships from the UK. And apparently there are vertically challenged people across the pond as well. And so the cost of Mounjaro is half the price at UniversalDrugstore.com. So there are still drugs in this country that are half the price by not adding the massive U.S. markup. Now, that is enough idle talk about TrumpRx.gov because it's nothing new. What is new and is not being discussed, and I don't know why, are two major reforms that President Trump is putting in place. The first one is going to come in April for all Medicare beneficiaries. As it currently stands now, if you have Medicare Part D, which of course you must have if you have Medicare, if you do not have diabetes or heart disease, your Part D policy will not cover your GLP-1. Your doctor has to attest that you have some sort of medical condition. In other words, you cannot use these GLP-1s simply for weight loss. For some bizarre reason, they want you to wait until you are overweight enough that you develop diabetes, and then they'll cover it because you're fat and you have diabetes, which is insane. So President Trump signed an executive order that beginning in April of this year, if you have Medicare Part D, you don't have to have diabetes. You don't have to have heart disease. You simply want to lose weight so that you don't develop diabetes. And as of April of this year, you will pay a copay as low as $50 for drugs that cost $1,000 a month at GoodRx.com or half that price in Canada. These are real reforms that are going to benefit people very quickly in less than 2 months from now. And
that's specific to the GLP-1s, though, right?
GLP-1s. Yes, exactly. And that's a big deal. I can't tell you how many clients who tell me, I cannot believe it. I went through the Medicare Part D enrollment tool. It told me that Mounjaro is covered. I go to fill it, and they say, no, you don't have diabetes, which is just insane. So that is a big reform.
Well, that's good to know. Very good. Yeah, go ahead.
Yes, the other big reform. We have heard for years that pharmacy benefit managers are hoarding rebate prices. Right, which is driving up the cost of prescription drugs for everybody, not just Medicare, but everybody, employer-sponsored, individual, et cetera. So President Trump, just 3 days ago, signed a law, and the law allows for reforms, major reforms for pharmacy benefit managers. No longer can they keep these massive rebates, which of course incentivize them to push brand name drugs, which are more expensive than generic drugs, or to crowd out smaller pharmacies because they don't participate in this rebate sharing. From now on, thanks again to President Trump, this is Public Law 119-75, better known as HR 7148. It was signed on February 3rd. No one's talking about this. You're talking about TrumpRx. Who cares? I'm talking about these major reforms that have been passed and are coming that are going to make a big difference. All these rebates now can no longer be hoarded by the pharmacy benefit managers. This law requires 100% pass-through of all of those rebates. It requires annual requirements of all the rebates they got and how they got them and how they're doing their pricing. It allows any willing pharmacy to participate, no longer crowding out smaller, more effective pharmacies. These are major reforms coming thanks to President Trump. TrumpRx.gov is nice, but it isn't what's really happening. What's really going to make a difference are the two things I just mentioned to you.
The PBMs. So one of the problems, I know Mark Cuban testified before in a congressional hearing about this a few weeks back, and one of the arguments that he made is the one you just made about rebates, but he also that these PBMs are vertically integrated, that you basically have PBMs that are spin-offs of the big health insurance companies, and so. Yeah. So it's not like an independent middleman in the chain. It's a co-opted middleman that is essentially providing health insurance companies with another bite at the apple. Yeah,
exactly. And so all of that's going to stop now. And this is major legislation that was passed, and it's a big deal. And it was only 3 days ago. Who's talking about it? Have you heard anybody talk about this? I don't understand. They should be talking about it. Instead, they're touting TrumpRx.gov, which is great, but that's been done for years. It's nothing new. These are major new reforms that are going to benefit everybody.
Well, I mean, the GLP-1 reform you mentioned in terms of Medicare eligibility and coverage, I mean, that cost savings is pretty straightforward. You're going to have to pay $1,000 a month. You're going to pay a $50 copay. Yeah, that's big.
That's unbelievable.
I mean, how insolvent Medicare is, I guess we'll talk about another day. But I digress. What about what kind of relief, price relief do you expect then from this PBM reform?
Oh, I suspect major price relief, especially for the tier 3 drugs, which are brand, tier 4, which is non-preferred brand, and of course, tier 5 and 6, which are specialty drugs. These are the biologics that I was speaking about earlier. Anti-rejection medications after organ transplant, GLP-1s, et cetera, because all of these rebates now have to be 100% passed through to the plan provider, can no longer be hoarded by the PBMs. And that's a major reform that we all can thank President Trump for.
Just going back to TrumpRx for a second. So if it already exists with GoodRx, which, as you said, is a publicly traded company, same prices, then does that give lie to the whole argument that's advanced by those who have a central planning disposition, and that's being advanced by the Trump administration too, if we're being honest, Dr. Oz and others, that we're going to use our purchasing power, our leverage to reckon with these pharmaceutical companies? That's not a thing. They can't do any better than a private company has been doing.
Correct. Yeah, I agree with that. I mean, this has already been done. Anything that they're doing at TrumpRx.gov is already being done in the private sector. So to have the government involved, I don't understand the necessity of that, since the private sector has already solved the problem, as the private sector almost always solves the problems. Uh-huh. But I do see the need for it. The need for it is, as I mentioned, a lot of people don't know what I told you at the outset of this conversation.
Yeah.
And number two, we got to get to the midterms.
Well, okay, so the political piece of this for sure. But so the net of this, what you think people will save with respect to pharmaceuticals versus what, again, that sort of median family is facing with increased premiums and deductibles because of those spikes that we discussed previously under the, writ large Obamacare plans.
Yeah, well, the major reforms are happening with Medicare, right? Obamacare just gets worse year after year. By the way, that brings up the last topic I want to mention to you before we end this conversation. The disastrous rollout of getcovered.illinois.gov, which was mandated by J.B. Pritzker. You can no longer use healthcare.gov. I have clients today. It is February 6th. They paid their premiums for January 1 using the disastrous website getcovered.illinois.gov, and they have no health insurance. They paid for a January 1st effective date. Many of them have given up and applied again for a February 1st effective date. We're still crossing our fingers to see if the policy will be issued, because the transference of their premium to the carrier did not occur. via getcovered.illinois.gov. So those who have been damaged by the rollout of the most disastrous website in U.S. history have an extra 30 days, well, actually 24 days or so, until we get to the end of February to appeal to getcovered.illinois.gov, so long as they had a policy that automatically renewed for 2026, to fix that problem and hopefully get coverage for March 1st. So there's an extra month to fix those errors. I would beseech anyone who is without health insurance now to get in touch with getcovered.illinois.gov because they have an extra 22 days.
Yeah, you mentioned this last time we talked. Just remind people that Pritzker and in his infinite wisdom set up a state website this go around so that you cannot enroll in the federal website. You have to enroll in on the state website. Give us the reason that he did that. And then again, just sort of restate the implication. So you have people who paid for health insurance that are now looking at least at the horizon right now, maybe as much as 3 months without coverage. And if you have a health event, then what happens?
Yeah. I had getcovered.illinois.gov on the phone with Blue Cross for 4 hours to fix a situation for a client of mine who is sick, has multiple medical conditions, and she was weeping on the phone to get her health insurance in place. It finally happened 3 weeks later by the grace of God in 4 hours on the phone with the bureaucrats at Get Covered Illinois and Blue Cross to get her coverage. It has been an unmitigated disaster. And the reason it's happening now, we taxpayers paid $1 billion to build a site that actually works. It has worked perfectly for 14 of the last 15 years, and that is healthcare.gov. To disrupt that process for the reasons Pritzker chose, Pritzker, our governor, moved everybody to getcovered.illinois.gov and forced them to use that site because he can open and close it whenever he wants, which is a difference between state-based exchange and state-federal partnership exchange. And then he can ensure that mandates that were passed in Springfield, for example, gender-affirming care for minors can be allowed, right, as a covered expense. President Trump, if you purchase a health insurance policy on the federal exchange, that kind of coverage cannot be included. So there was impetus to do this via J.B. Pritzker and Springfield Democrats. What they have done is hurt people without insurance now who dutifully paid their premiums do not have coverage as we speak right now on February 6th. This has never happened in my 30-year career. It has never happened since 2014, but it is happening right now.
And if you don't have, you've paid the premium. So what is the conversation with Blue Cross Blue Shield? Would be very interesting. I paid the premium. I haven't been conferred coverage. So I have a health event. I paid. You took my money. Do I have the terms of the plan I paid for or not?
The answer is no. The answer is no. We're working on it. We're going to create a ticket for you behind hundreds of other tickets. That's what's going on.
So I have to have a $10,000 surgery. Normally it would be covered. My first whatever it says, say my $2,500 deductible, and then the rest is covered. Now I'm paying $10,000 out of pocket, even
Correct.
though I paid the premium.
Yes, unless and until they get your policy enforced. And there are so many tickets, Dan, I can't even tell you. I have people, like I told you, just gave up and applied for February 1st. Those people who applied for February 1st are still waiting to see if February 1st is enforced. A complete, unmitigated disaster.
Wow. All right. Always illuminating. Thanks for distilling all this for us, C.S. C.S. Tucker, the founder of healthinsurancementors.com, healthinsurancementors.com, C.Steven Tucker. Again, thank you so much.
Thank you, Tim.
And C.S. joined us on Chicago's Morning Answer.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
RedState.com captures the pulse of grassroots conservatism. Red State staff of contributors are on top of breaking news with stories and analysis that challenge the established agenda. RedState.com educates, motivates, and activates passionate conservatives across America, arming them with the facts that put